heart disease and type 2 diabetes. Summary: a large percentage of the fat lost on low-carb diets tends to be harmful abdominal fat that is known to cause serious metabolic problems. 4. Triglycerides tend to drop drastically. Triglycerides are fat molecules that circulate in your bloodstream. It is well known that high fasting triglycerides levels in the blood after an overnight fast are a strong heart disease risk factor. 10. One of the main drivers of elevated triglycerides in sedentary people is carb consumption, especially the simple sugar fructose 11 trusted source, 12 trusted source, 13 trusted source. When people cut carbs, they tend to experience a very dramatic reduction in blood triglycerides 14, 15 trusted source. On the other hand, low-fat diets often cause triglycerides to increase 16, 17 trusted source. Summary: low-carb diets are very effective at lowering blood triglycerides, which are fat molecules that increase your risk of heart disease. 5. Increased levels of good HDL cholesterol. High-density lipoprotein (HDL) is often called the good cholesterol. The higher your levels of HDL relative to bad LDL, the lower your risk of heart disease. 18, 19, 20. One of the best ways to increase good HDL levels is to eat fat, and low-carb diets include a lot of fat 21 trusted source, 22 trusted source, 23 trusted source. Therefore, it is unsurprising that HDL levels increase dramatically on healthy, low-carb diets, while they tend to increase only moderately or even decline on low-fat diets 24 trusted source, 25 trusted source. Summary: low-carb diets tend to be high in fat, which leads to an impressive increase in blood levels of good HDL cholesterol. 6. Reduced blood sugar and insulin levels. Low-carb and ketogenic diets can also be particularly helpful for people with diabetes and insulin resistance, which affect millions of people worldwide. 29, 30. Studies prove that cutting carbs lowers both blood sugar and insulin levels drastically. 31, 32 trusted source. Some people with diabetes who begin a low-carb diet may need to reduce their insulin dosage by 50% almost immediately. 33. In one study in people with type 2 diabetes, 95% had reduced or eliminated their glucose-lowering medication within 6 months. 34 trusted source. If you take blood sugar medication, talk to your doctor before making changes to your carb intake, as your dosage may need to be adjusted to prevent hypoglycemia. Summary: the best way to lower blood sugar and insulin levels is to reduce carb consumption, which may treat and possibly even reverse type 2 diabetes. 7. May lower blood pressure. Elevated blood pressure, or hypertension, is a significant risk factor for many diseases, including heart disease, stroke and kidney failure. Low-carb diets are an effective way to lower blood pressure, which should reduce your risk